talk health. As the world marks World AIDS Day, the Zamfara state government is considering enacting a law that will compel all intending couples to go on compulsory HIV test before marriage as a move to tackle the spread of the virus. We have more in this report.
Zamfara state is one of the states with less number of HIV/AIDS prevalence in the country. About 12,772 infected persons are on the state register for antiretroviral drugs. That's according to the Secretary to the State Government, Abubakar Nakwada. The government says it is considering compulsory HIV/AIDS test for intending couples by the year 2025.
What we have is the figure of those who are currently on treatment, who are currently, receiving, taking antiretroviral drugs. The figure stands at 12,772. A bill has already been introduced. It was an executive bill. It is now on second reading, and from all indications, by the turn of next year, maybe early next year, a law will be signed. The bill will be assented by His Excellency and it will become a law, making it compulsory for individuals, planning to marry, to have a mandatory HIV/AIDS test.
Other partners also share their experience in curtailing the spread of the virus, especially in rural areas.
PrEP has 99% efficacy, so we make sure that each and every individual that is a key population we identify, we convince him to take that pre-exposure prophylaxis. There's a possibility that he has 99% protection of spreading the virus.
Under the general population, we are supporting 13 facilities across the state, and we have another community component, not only facility-based. We normally go to community. We have a CBO that goes to community and conductors and provides services to the people.
HIV/AIDS victims in Zamfara also expressed their displeasure over the continuous stigma from members of the public.
It is not easy to cope up with the stigma of our community due to the lack of knowledge on HIV among the Zamfara state people and even in the country at large. Some people can feel to run away from an individual whenever they discover that this person is living with HIV. Even our friends, our family, somewhere run away, let's say, stop relating with us because of the virus.
The government says it has put mechanisms in place to continue sensitizing the public on the disease. Theophilus Darufai, TVC News Kusau.
Dr. Adebobola Basharon, who is Director, National Coordinator of the National HIV and AIDS, Viral Hepatitis and STIs Control Program, NASCAP, Federal Ministry of Health, joins us now from Abuja. Doc, it's good to have you join us on TVC News at 1. Let's talk about the theme of this year's World AIDS Day. Take the right path, my health, my right. What is its significance?
Thank you very much. Good afternoon. So this is another World AIDS Day, and the first was done in 1988 under the guidance of UNAIDS and UN joint agencies for United Nations member states. So this year's theme definitely talks about take the right path, my health, my right. It simply means you have the right to health, universal health coverage, regardless of where you are. If you are an HIV, a PL/HIV level client, definitely you need to have access to health, to care, to affordable care under the leadership of your country, your government, and also the people in the community. So this year is unique, and Nigeria again also has additional theme, which looks at how we can sustain the gains that we've had over the years in terms of HIV response. As you know, the HIV response in Nigeria started in 1987, and we've made significant progress in terms of treatment. Currently, we have about 1.6 million Nigerians that are being treated for HIV out of about 1.9 million that are living with the virus. And we are still doing everything possible as a government to get more into treatment. The other sub-theme for Nigeria is also to ensure that we have zero infection in children. It's also a priority for the country. We are doing all this together to make it a priority for the country this year.
All right. And Doc, you had a unique agency of government. First, what is the relationship between HIV and AIDS, viral hepatitis, STIs, and what are the major challenges your team encounters performing this role?
Thank you. So HIV, as you know, is caused by a virus, HIV virus, HIV-1 and 2 virus, which belongs to the group of retroviral or retroviruses. While hepatitis itself is also a virus, but it is another form of virus. It has the hepatitis A, hepatitis B, and hepatitis C are the major ones. So the relationship between the two, first of all, is that both of them are blood-borne. It can be infected through blood and through sexually transmitted methods or modalities. So the third is STI. So all of them can fall together under the STIs category, sexually transmitted infections category. And now under STI, we still have other ones like the gonorrhea, like the syphilis, like the herpes simplex, like human papilloma virus that causes cervical cancer. So there's a continuity in this because we know HIV reduces the immunity in the body. And once the immunity is reduced, you have tendency to easily have other infections that your body may not be able to control, to fight. And so some of the antiviral drugs currently help us in dealing with some of these problem of viral load in HIV clients. And in addition, hepatitis itself, B, is one that, once you have hepatitis, it means they affect the liver. And hepatitis itself, C is curable. It's curable if you detect early and you treat early, it's curable. While hepatitis B can be managed. But the priority for the country is to stop infections of hepatitis B from mother to child, infection of HIV or transmission of HIV from mother to child. So a lot of guidelines have been put in place by the Federal Ministry of Health to guide this, and there is continuity in a program of such that we have now is to ensure that we have adequate coverage in terms of prevention, control, and treatment. So all of them fall within the same categories of blood-borne infections, and to some extent can be transmitted through the sexually transmitted models.
You spoke about sustaining the gains that Nigeria has recorded, but also talk to us about the challenges that you encounter. And I was also wondering if you're worried about dwindling global funding.
Yes, we're worried about dwindling global funding, definitely. And the leadership under our current president and the coordinating minister of health, they've worked on something called unlocking the healthcare value chain, where most of the items we need, so this is also speaking to the challenges, most of the items we need for care, for protection that used to be imported, definitely will be produced in country. So it's a drive of the current government to ensure that we produce some of the things we need for the treatment, for the consumables in Nigeria. So this is a key challenge. The other issue of interest is in terms of funding. There's increased funding, of course, you know this. There's increased funding because the government is generating more resources and we're having more resources to put into the health system. So the challenges are mainly funding and the sourcing of commodities and materials that are imported. But now the government is looking to beyond that, and the system we have is going to develop a system that will produce most of the things locally under the unlocked healthcare value chain and under the SWAP led by the coordinating minister of health, Professor Mohammed Ali Party. So above all, definitely some of these challenges are there, but they are being circumvented or mitigated against through to other government policies that is in place with this current administration. So with dwindling funding, we are sure Nigeria is sustaining the gains in terms of treatment. We've been able to increase treatment to 1.6 million. In terms of viral load suppression, those that have viral load suppression are huge in number, close to 90%. So transmission is lower. And the third pillar, which is also a priority, is ensuring that we reduce transmission of HIV from mother to child. And this also affects hepatitis and syphilis transmission from mother to child. So sustaining these gains is a priority for the government, and this is what we are pushing and driving this season.
Director and National Coordinator, National HIV and AIDS, Viral Hepatitis and STIs Control Program, Dr. Adebobola Basharun. Thank you so much for talking to us on TVC News at 1.